The psychological disorder that I chose to talk about for our clinical video presentation is erectile dysfunction. Erectile dysfunction is the inability to maintain or get an erection. This is only classified as erectile disorder if the problems persist for more than 6 months and causes you stress or loss of confidence. This is an interesting disorder because it can come from physical reasons, psychological reasons, or neurological reasons. This is a pretty widespread disorder affecting more than 30 million American men. Erectile dysfunction, which on the list is shown as erectile disorder, but the words are interchangeable. Again, has the symptoms of lasting longer than 6 months or causes stress or loss of confidence. Those are the key words there. This can come, like I said, from a myriad of reasons. Examples of physical reasons could be diabetes, high blood pressure, heart conditions, premature ejaculation, or something happening with your testosterone. And what I found interesting about this disorder is it could be neurological as well, coming from diseases like Parkinson's or strokes. And then lastly, psychologically, this version actually affects most men under 40, while the disorder is widely known to affect people older than 40, normally even older than 55. But the psychological reasons I find to be the most interesting. That could be performance anxiety, religious taboos, sexual abuse, PTSD, other things along those lines. But that's what makes something like erectile dysfunction very difficult to put your finger on, because it could come from any of these reasons, and it's a little bit harder to pinpoint, especially with the symptoms being not as, no pun intended, hard to find as a lot of other disorders. Treatments for this usually start with something like a lifestyle change. That could be something like quitting smoking cigarettes. This could be more exercise. This could be eating fruits and veggies. There are also medicines that could help with this, Cialis, Viagra, but those are not long-term solutions. That blocks the enzyme that would generally make your penis soft, but again, not a long-term solution. And what most people end up turning to is some kind of psychotherapy to get to the root of the stress, anxiety, or depression. Erectile dysfunction affects a lot of men, and most men know the feeling of going from this to this, using the banana example. And I've seen studies that it affects men underneath the age of 40 more and more every year. I did this to make the awareness of this as a psychological disorder, as well as physical, etc., like I spoke about. But erectile dysfunction affects more and more men every year, and therapy is the best way at this point to be able to combat that. Thank you. Have a good day.